I can get for you.
Alright, so I have gathered all of my supplies and I have done my first med check in the med room. Verified it against the medical administration record to make sure I have the right patient, right med ordered. So I'm going to come into the patient's room. Knock, knock, knock.
Hi.
Hi, I'm Jess. I'm going to be your nurse today. It looks like we're going to do a couple of things here. Can you verify your name and date of birth for me?
I am Ivy Armstrong, birthday 3/1964.
Thank you so much. And is it okay if I address you as Ivy?
Yes, that's fine.
All right, wonderful. And Ivy, do you have any allergies?
Just to latex.
All right, I do have that noted there. So we will not be using latex today. If for some reason it does pop up, I will go ahead and get something different for you. I am going to go ahead and raise your bed, Ivy, but before I do that, I'm going to go ahead and close, give us some privacy. Is it okay if I flip the lights on?
That's fine.
All right. I'm going to flip the lights on. All right. And Ivy, so what we're going to do today is we are going to, while I tell you what's going on, I'm going to go ahead and raise your bed so I don't hurt my back. It looks like the doctor wants an IV started with some fluids. So that will require me to place an IV in your arm. I will have to do a neuro assessment and a respiratory assessment. So it will require me to listen to your lungs and all of that. Let me
Okay.
get all of this equipment situated here. I'm going to put the arm rail down, and then I'm gonna go. Is it okay if I set my stuff on your bed down
That's
here?
fine.
Okay, wonderful. All right, so let's get you going. And Ivy, can you tell me where you're at?
I'm in the hospital.
Wonderful. And can you tell me what year it is?
It is 2024.
Beautiful. And what day of the week is it?
I think it's Wednesday.
You are correct. It is Wednesday. What are you here for?
I'm here because I've been vomiting and having diarrhea. I think I got a stomach bug.
Ooh, okay. All right, that does not sound fun. So Ivy is alert and oriented ×4. Do hand hygiene. I am going to put some gloves on. All right. So Ivy, if for any reason, when I am placing the stethoscope on or, putting the light in your eyes or anything like that, if that hurts, just let me know. I'm gonna come back over here to this side since I have that arm rail down. All right. So I am gonna go ahead and check out here. I'm gonna start with looking at your pupils, okay? So
Okay.
come in. Next.
I'm going to use that. So that your arm doesn't fall off.
All right.
I do that
And
a
then
long
can
time
you
ago.
go ahead and
Next, I'm going
look
to go to the med
at a
room,
spot on that
and
wall
I'm going
there?
to get
Yes.
your
Let me raise you up just a little bit, Ivy.
IV pump.
You probably can't look across the room when you're laying flat.
No.
Yeah.
Thank you.
You're welcome. I'm gonna take these off since I touched the bed rail. And then we'll go right back to it. Oh, there's the trash can. Okay. So I'm gonna have you focus on the wall over there, and then as I bring my pin light in, go ahead and follow it with your eyes.
Okay.
Beautiful. Let's do it again. Beautiful. All right, so it looks like the pupils are equal, round, reactive to light, and accommodating. All right. And can you smile real big for me?
Cheese.
Great. All right, smile looks good. Everything looks even. No drooping, sagging, anything of the face.
Okay.
And then I'm going to go ahead, and while I'm doing that, I'm going to have you squeeze my hands, okay? We're going to squeeze them at the same time. We're just going to check your strength there, okay? Squeeze, 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 squeeze. Wonderful. All right, and let's just do some range of motion really fast. Okay, so bring your arms up. Send them out. All right, rotate those wrists. Wiggle the fingers. Wonderful. All right. And then Ivy, I'm gonna go ahead and unbutton your gown here. so that I can look at your chest, listen to your lungs, do the respiratory. Make sure we don't hear any bronchi, wheezing, crackles, anything like that, okay?
Mm-hmm.
I'm going to go ahead and expose you. Is that okay?
That's fine.
Okay, wonderful. All right. I'm gonna make sure my stethoscope the diaphragm is warm, so I'm not placing it on your skin. And then I'm gonna listen, okay?
Okay.
And I'm gonna listen to 6 spots on the chest for 1 full breath. So breathe in. Beautiful. We're gonna go down over here. All right. So I don't hear any evidence of any bronchi, wheezing, anything like that. Have you had any productive cough lately, like in the past 24 hours or so with this nausea, vomiting, like spitting anything up, coughing anything up?
No.
Okay, beautiful. All right. So I'm going to go ahead and take a peek at your chest and make sure, you know, the rise and fall, it's all equal. There's no labored breathing, anything like that. All right, so it looks great. It's equal bilaterally, and it looks like you are breathing, respiratory rate is 16 breaths per minute. So we like to see that. I'm going to go ahead and pull this up for you.
Okay.
All right. Now we come with the fun stuff.
Uh-oh.
I promise we'll do it quick and fast. Be as painless as possible.
Okay.
I'm going to go ahead and get your medical administrative record pulled up here so I can do my second med check against the IV order and all of that. Let me hand sanitize while I do that. And put on some gloves so we can keep you sterile.
Over here. So my third check is going to be making sure that my patient is IV Armstrong and that she's getting
All right.
100 milliliters of the 9% sodium chloride over 10 hours. And that she is allergic to latex.
Okay. So I went ahead and did the second med check to verify the orders for the IV and the fluids for the correct patients, routes going IV, and then dosage, indication, and then I'm gonna walk the patient through the steps of doing an IV. All right. IV, here we go. I'm gonna get my stuff situated here, okay?
Okay.
All right, wonderful. And I went ahead and placed this under there just so that we don't get your linens all wet, okay?
All right. Thank you.
You're welcome. And let me get this all set up here.
Anything else before I go through it?
Maybe. Okay. And then once I have this, then we'll do the fluids.
Okay.
Okay.
Are they gonna help me feel better?
It will.
Okay.
It will help you. All right, so the first thing I'm gonna do is I'm going to go ahead and find a good vein for you, okay?
Okay.
And I'll go ahead and place the tourniquet about 3 inches above the site. But right now I'm just gonna take a peek and see, look at those good, healthy veins that you have. Sorry about that.
It's okay.
I didn't mean to snap that on you. That was a cruel trick. All right. Let's take a peek. All right. That one looks really good right there.
Okay.
All right. So then I'm going to go ahead and, I don't know whose that is, but I'll set it right there in case it's one of yours. All right. I'm going to go ahead and get the site all clean.
Okay.
So whoops, wrong one. I'm gonna pop my here, and I'm gonna go side to side. 28, 29, 30. All right. I'm gonna put it back in here, and then while that's going, I'm gonna go ahead and get my J-loop primed. I'm gonna open up the clamp, and then now I need my wipe. But it would be sterile coming out of the package. So I'll just keep it in the boat, but 28, 29, 30. And then I am going to pop this off so that way whenever I get the IV started, it comes right off. And I need to keep that as sterile as possible. So I'm just gonna push it through, get all the air out. All right, and then at the same time I'm pushing, I am going to not throw my cap in the trash, and I'm going to do positive pressure. Okay. And then I'll put this back in my boat. All right. Ivy, are we ready? Here comes the fun part.
Ooh, I'm nervous.
No, don't be nervous. I'm nervous too. We'll be nervous together. So I'm gonna open this. All right. And then I'm gonna throw that away. Make sure the bevel is up. Everything looks good. I'm gonna get my boat, my J-loop and all that ready. And I have my tape to secure it.
Okay.
All right. All right, so here we go. You're gonna feel a stick on 3, okay?
Okay.
1, 2, 3, stick. Beautiful.
That
Now I'm
wasn't
just
too
gonna
bad.
advance it. Okay. So
Okay.
we're just gonna push it straight in. Pop my safety, and I'm gonna occlude that. All right. And that's why I do my good job, and then I'm gonna have the patient help me, and here's where the tape comes in, because we're just gonna secure it right there while I get you all cleaned up.
Okay.
So I would typically throw the supplies away, but we're keeping them. I need to take this and put this in the sharps. All right, beautiful. Let's get you cleaned up. Wasn't that bad, was it?
No.
Okay, good. Let's pop this tourniquet. All right, we're gonna throw that and this. All right. So then we're gonna get this, and look, it looks like pants. All right. So this is gonna go around, and it's clear, so that way we can see what's going on, okay?
Okay.
All right. So I'm going to put it around. And we start from the waist and work our way down.
Okay.
Okay? Like pants. We stick our legs in. All right, now I'm gonna go from the bottom. Oh, maybe if it wants to do it for me. Okay, that's gonna go right here because I'm gonna mark it with my initials and time and date that I started the IV. Although the new policy is that we don't change the IVs like they used to. So I'm not sure if you've been in since that new policy started, but they won't be coming in harassing you
Oh, that's good.
to
I
get
don't
it all
want to get
changed.
stuck again.
Yeah, we don't like to get stuck.
No.
All right, IV. So I'm just gonna put that on the side. All right, and it's gonna have the date and my initials, and then I'm gonna open this up. All right, and then I'm going to pull back just to get some blood in there. All right, and then I'm gonna flush about, since it's the mannequins, I'm just gonna flush about 2 to 3, but I would do it in this arm. So I'm not gonna do it in this arm. But if it was a real patient, I would do probably the whole thing. And then I'm gonna keep flushing as I stop it for positive pressure so that nothing backs up. And then I'm going to take this, make sure we keep that on there. Remove the tape. All right, and then that's what this is for, to make it nice and fun. All right, beautiful.
That was a good job. I barely felt it.
Thanks. All right, so let me just get this cleaned up really fast,
Okay.
and then I'll get your IV started, okay? Or your fluid started, okay?
All right.
All
Thank
right.
you.
So it looks like the doctor has ordered, he wants you to have 1,000 milliliters over 10 hours. So basically what we're gonna do is we're gonna do 100 milliliters per hour, okay?
All right.
All right, so let me get this set up. And then, so typically this would be in the bag. We want to keep this secure, sterile, because that's going to be touching
Mm-hmm.
this. I pop this top just to make it easier. I'm going to go ahead and pull this off while I'm holding this. You don't want to do that. It's normally wrap or round. I'll put that right there. We're going to not do that. All right. And then I'm gonna hang it. And then I want to prime the line. So I want to get any air bubbles out. So I already squeezed it since it's an old one, but I would squeeze it and fill the chamber halfway. And then I would pull the trash can close to me because we're going to prime this line, and it's been used so many times. Okay. So I need to make sure it is undone. Okay. And then I'm going to take this off, and we're going to let it work through. And then I'll stick this in. And I want to make sure when I'm putting it in here, Ivy, are you listening?
Yes, I am.
I'm going to quiz you. This top part goes up here, and then this snaps in.
Okay.
I'm going to hold this still because I don't want this to touch anything. Push with pressure. Push that on. And then we're going to turn this bad boy on. And this is then where I'm going to do my third med check. All right. And it's going to be, turn that arm on. Oh, it's got to run through its system. All right, so new patient, yes. Adult, yes. We select the channel, no guardrails, basic infusion. So the volume that's in this bag. Oh, hang on, sorry. We're gonna do and then we're gonna do 100 milliliters per hour. And then this is where I would make sure that this is correct. So we're doing the 0.9% sodium chloride, making sure that there is 1,000 milliliters in this bag, verifying, and it's gonna scream at me because I'm not going fast enough. So then I'm going to want to grab this, and we're gonna do this for 30 seconds, 28, 29, 30. All right. And since I just did this, I'm gonna go ahead and I just flushed it, so I'm gonna go ahead and pop this on.
Okay.
All right, and I'm gonna make sure everything's open. So we're gonna open this, we're gonna open this, open that, and then we're gonna start.
All right.
All right, and I'm gonna wait here for just a second to make sure it all goes through. It's going through, everything looks great.
Thank you.
All right, and then I will get you cleaned up, and so I went ahead and documented in your file everything we did today. So your assessments, your IV, the fluids, and then I'm gonna go ahead and turn the light off. Unless you want it on. Do you want it on?
You can turn it off.
Okay. All right, let me put your bed rail up. And then, Miss Ivy, do you want to stay sitting up, or do you want me to lower you down?
You can leave me like this. That's fine.
Okay.
All
All
right.
right.
Thank
and
you.
then I'll lower it down. And do you want your door open, closed, halfway open?
You can close it.
All right. So I will go ahead and put your call light, give you your call light, and then if you need anything, you just let us know, okay?
All
Hopefully
right.
that'll start kicking in for you, but I'll be back to check on you.
All right. Thank you.
You're welcome.
Bye-bye.
Bye.